Okay, this is a little video that I've been asked to make to help a couple of clients I have who've got problems with sciatic pain, leg pain, buttock pain, prolonged sitting maybe being the cause. So I thought if I show you some exercises that you can start doing in sitting, because then they could be done at your desk, and then move to a couple of stretches on the mat that we're more familiar with. So firstly to say, don't try to stretch the sciatic nerve. Okay, it's not going to respond well if it's already aggravated to being lengthened. It could be aggravated further. So think more about mobilising it and stretching the structures around it that might be tight and irritating it. So I try not to think of just the nerve itself. Think more broadly than that of the neural system and how it could be not mobilising well, not moving sort of smoothly, rather than it being tight and needing stretching. That would be the first thing to say. So from a sitting position, sit away from the back support of your chair so that it's not in your way and doesn't stop you moving. But the other thing is then you can lengthen. And that would be the first thing, is just to get that length that we always look for in Pilates, where you try and get the crown of your head really floating tall. So in sitting, focus first, just making sure that your weight is equal between both sitting bones, and then that you float up. So draw as much length from the spine as you can by getting the crown of your head growing really tall. Open those fronts of shoulders and settle them down. And with that chin very slightly tucked back, or think of it as tucked back anyway, so you're at least correcting any of that forward sort of protracted posture that you might develop if you're doing a lot of screen-based work. Just try and draw the chin back a little bit to lengthen the back of the neck, to give some space in those joints in the back of the neck, and then move from there. And the first stretch would just simply be taking the chin down onto your chest. And take some breaths with it there. Good. Do that a couple of times. If it already feels really tight in your back to do that, just regrow. Try and make sure that you're not slumped forward, because if you take your chin down there and everything's a bit tight down your back, then that could aggravate. So make sure before you start, just reiterating, that you're really tall, and then take your chin down onto your chest. Okay, when you've had a couple of practices of that, same thing, position-wise, but take your ear over towards your shoulder. So we're looking for that side stretch down the neck. Make sure you have a couple of goes to both sides. Always keeping that chin gently drawn back, giving you the length and the space in the joints at the back of the neck. We're going to move our weight down the body towards the area that you're most interested in, whilst acknowledging that the whole system, the whole spine, is going to affect that sciatic region. We want it all moving well, moving functionally. Okay, so let's do some shoulder rolls. We'll take the shoulders right up and then back. So in general, like I would usually say, we do enough forward movement with those shoulders. They tend to droop forward or roll in as a tendency. So I don't think we really need to encourage any more of that movement. Let's just roll them back. Open their fronts. Start thinking about the shoulder blades moving on the upper back, sliding down towards your pockets as you take those shoulder tops away from your ears. Good. You can do this as often as you like throughout the day. Okay, and then we'll take it to some twists. So familiar to most of you, arms across your chest, just keep those shoulders back and down away from your ears, starting to think about just engaging here in your centre to make sure that the pelvis stays still, your weight stays equal through both sitting bones, and you take your upper body around. So take that to the twist and have a breathe in while you're in the twist. So I like to get the upper back moving in a rotation and a side bend motion before trying to extend it. So I think the extension is what gets most stiff, and then it's most difficult to isolate as well. But if you get it moving with some twists first, I feel like you stand a chance then of getting your extension going. Alright, so when you've had at least a couple of goes to both sides, twisting, breathing in when you get there, and then coming back. Then we can take it to the side bends. Alright, so our mermaids in sitting, just take a reach with one hand, have a side bend, make sure your weight stays down equal through both sitting bones so you don't end up leaning off. And while you're breathing in, you're really opening up this side more during the stretch. Good. So I don't know how long this whole seated routine is going to end up taking, but if you can just memorize it or write it down in points, it's something you can probably do a couple of times throughout the day quite easily. Let's take it to a chest stretch now, starting to bring in that extension through the upper back. So we're going to try and maintain our low back position, neutral spine, and start thinking about extending through the upper back, which is difficult when you haven't got a lever to go back over. So imagine you've got a chair back right up there in between your shoulder blades, and try and lean back over it. So you send the centre of your chest up to the ceiling, like it's being magneted up and then down. So just thinking centre of chest up, as if you're leaning back over a lever, but maintaining your low back position, not arching into that for now. You want to bring some arms in for a nice front of chest stretch. Open up the fronts, send the centre of your chest up to the ceiling. Good, one more like that. This is what we want to encourage. This is the opposite of what tends to happen in our upper back when we get a bit rounded over at the desk. Okay, now we're going to put some movements together. Come maybe a little bit further to the front of your chair to make sure you've got plenty of space behind your bottom. Link your hands in front and look down between your knees. Lift those arms up, separate between your shoulder blades and have a breath in, stretching that space between them. And now watch as your hands go up overhead, sending the centre of that chest up to the ceiling. You're just looking at your hands, breathing in at the top. Lovely, open and bring them around. This is where you want to try and put them behind your bottom. Push them away if you've got space to stretch the front of your chest. Good. And then relax and bring them to the front. We'll do it one more time. And this time I'll change the arm position, but only if your shoulders are okay. Otherwise, do the same again. So you out-breath the arms up. This time turn so the palms push away, as long as you don't have any impingement or rotator cuff problems in your shoulders. Breathe in. And then lift up with those hands now pressing the palms up towards the ceiling. You're looking up, remember to send that centre of chest up and breathe in. And then open and bring the arms around. We'll link them behind you, one more big press away. And breathe in. Good. Okay, let's bring it a little bit further down. We'll bring it down to the pelvis, where I want you to start practicing just feeling. This might be difficult for you to see front on, so I'll try coming sideways. But you're tipping back into your low back space. So you're just rolling back over your sitting bones, creating as much of a curve into the low back as you can, but keeping the chest pointing straight forward. So it's not just about slumping down, it's tilting the pelvis back underneath your upper body that's staying upright. I'll take it sideways. Hopefully you can see it better. A bit of space behind your bottom so you can tip back, rolling over those sitting bones and then tip forward again. And all the movement is happening below the level of your rib cage, with the centre of the chest staying nicely elevated, pointing straight forward. Shoulders are remaining open, back and down, rolling, tilting, and just curving off that very low back, and then coming forward again. And this is a way of just gently mobilising your low back while you're sitting, without anybody knowing what you're doing if you're looking at your screen. Okay, we'll bring it back forward again. To a glute stretch. All right, it's similar to what we do on the mat, but this is a seated version. You just want to cross one foot over the other, rest it on the ankle onto your opposite thigh, and let the knee drop down. Okay, so you're opening up the hip joint. And then from there, try and fold forward from your hips. So again, don't round over. We're going to try and fold forward. And if you maintain your back position, that length through the back, your neutral spine, as you fold at the hips, you should get a strong stretch into the bent leg, hip and glute. All right, and tight glutes can be a contributing factor in sciatic nerve pain. So this is one way of stretching them out without having to come all the way down to the mat. You'll get a much more effective stretch if you just maintain your consistent back position and make sure it's a fold forward from the hips. With all your stretches, just breathe steadily. Don't fight them, ease into them. Okay, come back up so you can do the other side. Same thing. Folding forward. Okay. You get the picture. Now the last one to do in sitting is going to be some sliders, so some neural mobilisation exercises, and I'll try and sort of build them from pretty simple to something that needs a little bit more coordination, but then hopefully when you get used to it, is really effective. Ideally, you want your legs to be able to hang free. Now, I've got very short legs, but even I need to raise this up a little bit, see if I can get enough height. So, if we just start with simply taking the leg out straight and then lowering it back down again. Okay, just work on one side at a time. Work with the ankle relaxed, because when the toes are pulled up, then you're putting more of a strain or a stretch or a length on that system. So let's just start with the ankle relaxed. And then we'll add elements to it. Okay, so now what we're going to do is have the ankle flexed when it's down, with the toes pulled up, but then as you straighten the leg out, point the toes. So you flex the ankle, point the toes. So you're putting a little tension on one end, then you tension more towards the other end. And this is the principle of mobilising that structure. Okay, and then there's more you can add, because we can add from the top as well. We can add from the head, and neck and upper back. Okay, so when it's at its least tensioned, it's back here. So there you can put the chin down onto the chest. But then as you straighten your knee and point your toes, lift your chin up. And then down again. And then up. Good. So you're pointing your toes, straightening your knee whilst looking up ahead. And then when you bend your knee and flex the ankle, look down. You can add into that, like I said, a bit of upper back as well. So you can sort of slump forward a bit with the chin on the chest. That will deepen the lengthening from the top end. Okay, and that's one really good mobilising technique for the neural structures at the back of the body, including that sciatic nerve. And we will bring it down to the mat now. So I'll just move this chair out of the way. On our way down though, I just want to talk about roll downs. So roll downs are a really great way of mobilising your back. They mobilise you into flexion, which is something that often if you're sitting, you don't necessarily need more of. The other thing is that if your legs are straight, they can put quite a lot of strain on any irritated sort of sciatic structure. So before we come into a roll down, let's just talk about extension, being the opposite of all that sitting and probably something that you more need to do when you get up from your desk. So our usual standing position, come nice and upright, feet are hip width distance apart, length through the whole spine, pop your hands onto your bottom or the back of your pelvis and just simply have a stretch back. You can do this a couple of times or 5. Really often throughout the day. I would really encourage just doing the opposing movement to what you're doing too much of. As long as it doesn't aggravate your back. If it feels a bit stiff and sore in your low back, that's okay. We know that moving into a bit of stiffness and soreness is fine. What you don't want to do is aggravate the actual symptom you're having of it coming down your leg or causing any pins and needles or causing any pain that goes beyond the knee. You know, you don't want to be aggravating that actual neural symptom. But if you're feeling some stiffness and some soreness in your low back while you're moving, that's okay. And then when we take it into a roll down, make sure that you put enough softness in the knees that you're not overstretching at the back. And the other thing is that chin doesn't have to come right down onto your chest. You don't have to ram your chin down. Just leave it nice and soft and focus on your spine movement. Okay, and then when you do rebuild, you're using your out breath as normal. When you get back upright, just add in that little stretch back. Don't ram the chin down, make sure the knees are soft. Focus on spine movement. Moving on your out breath. Rebuilding, restacking, growing really tall and then having your stretch. Okay, we'll use one more just to come down to the mat. All the way down. Okay. So let's do our glute stretch here. You'll see the principle is pretty much the same as in sitting that we just did. That you cross one leg across so the ankle is resting on the opposite thigh. And then try hopping both feet up so that you can reach through and hold your thigh. And just support that stretch. Now, if you struggle to reach, then it's okay to round your back off into the mat. But if you've got the space to reach and hold these legs like this and support them, try and maintain a little space behind your low back because that will make it a much more effective stretch. So try and keep that neutral spine position even when you're stretching. Okay, the other thing is to get a slightly different spot, try crossing the legs completely, like as if you're crossing them underneath your desk, and hug around both knees. You'll feel it in a different area of that hip and glute and low back probably. Good. Come down so you can do the other side. Make sure you breathe steadily with these stretches. You don't hold your breath and you don't fight the stretches. You're just slowly trying to gain some movement, trying to gain some length. Lovely, try that alternative. See which gives you a more efficient or effective stretch that's better for you and where you feel you need it. Good. Okay, and then bring the legs down and we'll look at doing some of those slider type exercises here. Before we do that, just to mention hamstring stretches, that's great as well. Like we often do get too tight in the hamstrings from too much sitting and other sort of lifestyle activities. So that's fine, do some hamstring stretches, do it here, maintain your neutral spine, straighten up the leg to stretch the back of it with the thigh supported, but again keep that ankle relaxed, don't draw the foot back. Okay, you'll be getting more of a calf stretch, probably more than you were looking for, and it will put much more tension on the neural tissue as well. So let's just stretch the muscles and we'll mobilise the neural tissue. All right, don't forget to do both legs, of course, and then I'll show you that slider. Same principle though, as we did with the slump version that we did on the chair. This time, start with the foot relaxed, so that your toes are fairly pointed, and then bend it and draw the toes up towards you so you have flexed that ankle. And then as you straighten it, point the toes, bend and straighten. Okay, and you can just work here, incorporating the knee bend as well as the ankle movement. But you could progress it, as long as you don't get any aggravation, to keeping the legs straight and just putting that on and off. But like I said, don't bring on any neural symptoms, tingling or neural pain coming into the lower leg, foot or ankle. Okay, so if that does feel a bit aggravating, then bring it back down and do it here, incorporating the knee flexion. Great, all the way back down. Last thing to say is spend some time on your tummy. Okay, because this, on a flat surface, just your mat on the floor, is a great way of opening everything up, relaxing into your back, being in a different position to which it spends most of the day. And lying on your tummy may well just be enough. You don't need to push up into an extension or a cobra type of stretch. You may even find this is too much some days and you need to put a pillow underneath your tummy, something to sort of flex over. But hopefully you can get to this position. And then you could work towards coming up onto your forearms and spending a little bit of time just breathing and relaxing into your lower back being an extension. Okay, and if that's good, you're not getting any pain in your back or, more importantly, aggravating any of that buttock or leg pain, then you could practice coming up a bit higher and using your hands to push you into more extension. Okay, take it easy. You can do like you did in standing and do some little presses, 5 repetitions. But more importantly, just lie on your tummy and relax. Doctor's orders. Well, I hope that was helpful. Feel free to share